I'm Edward Warfield, the publisher of CityBiz, and I'm honored today to interview Prasad Sunkara, who's the co-founder and CEO of Eyegenex. Welcome.
Thank you. Thank you very much for this opportunity to talk to you and give some information on Eyegenex.
Great. So Eyegenex is focused on preventing vision loss through gene and peptide advances. Can you provide an overview and introduction to the company?
Yeah, Eyegenex is about a year-and-a-half-year-old company, a startup that I co-founded with a professor, Professor Ram Nagaraj, who is a professor in ophthalmology department at the University of Colorado. And Eyegenex focuses preventing vision loss and also restoring vision in glaucoma patients. And we have three assets. One is a gene therapy, another is a peptide therapy, and the last one in early stages is a stem cell therapy, which actually would help, if it works out, in restoring vision in people that lost vision, which would be a breakthrough if it works. In early studies, it works in mice, but we don't know, how far we can take it. Hopefully, it'll work in humans. That'll be wonderful.
That's an exciting history and story to tell. So, what are the primary causes of glaucoma, and how large is the glaucoma population in the United States?
The glaucoma, the incidence in US is about 3 million. About 1% of all the population ends up with glaucoma around the world. So you can expect about 80 to 100 million worldwide and about 3 million in US. Why I'm saying 100 is because in certain populations like Chinese and Japanese, Asian population, the incidence is really high, in as much as 90% in Japanese and older people and 60% in Chinese that were looked at in Singapore have glaucoma. So there is a high incidence of glaucoma. And the reason for that glaucoma is we have what we call a fluid called humor that usually gets drained, and that helps to keep the shape of the eye and all that, and usually drained as it produces, it drains. But in case of glaucoma, then it doesn't get drained well. So it increases the pressure, which kills the cells that are connected in the optic nerve. Those cells are called retinal ganglion cells. So they die, and as a result, the connection to the optic nerve dies, which prevents the signal to the brain to see. So it's a chronic, slow, progressive disease, glaucoma. And unfortunately, fortunately, you can prevent it with eye drops and increase the drainage. But about 10 to 15% of those patients, even under low normal tension, progress into glaucoma and they lose vision. There is no treatment. There is no cure for glaucoma. There is only a prevention through eye drops.
And can you explain what small heat shock proteins are and how they prevent vision loss?
Yeah, actually, that's where we come, in terms of treatment. Prevention, eye drops are there. But like I said, 10 to 15% progress. And Professor Nagaraj has been working in this area, and he came across these heat shock proteins, which are what we call, they prevent the death of cells. And these are also called chaperone proteins and anti-apoptotic proteins. So what he has shown is a small fragment of that protein was able to prevent the death of retinal ganglion cells due to this increased IOP, increased intraocular pressure. And he did a lot of that work in mice and rats. And the peptide only stays there a little while. You got to inject more often, and you have to inject intravitreally into the eye, which is getting more common because there are some other drugs that people use it in the way they're administered, but it's not that easy. So what he has come up with is a gene therapy. He has put the gene that codes for that protein into a adenovirus, and also that virus he has also engineered so that it only expresses in retinal ganglion cells. So he has constructed that, re-engineered that adenovirus, and he has shown that he can get it expressed in retinal ganglion cells, this protein, and prevent the death of retinal ganglion cells, and also prevent the vision loss induced by these insults. So what we have done is I've seen his work in literature. I spoke to him, reviewed the literature, looked at the patents. It took about 6 months to do all that. Then I joined hands with him. So we started a company called Eyegenex, and and then we raised a little bit of money, less than $1 million, and we were able to do some more studies in monkeys, which is obviously is more closer to humans. So I'd be happy to talk more about it, but
Yeah, let's stay on. Let's stay on. Let's. So your colleague was at the University of Colorado. Is that
yes.
correct? And so what was involved in licensing? His involvement in licensing it from the University of Colorado.
I mean, I was the one who, he can't, as a professor, his conflict and all that. But so I licensed it from the university. And then, we need to raise a little bit of money to do the work, progress the work. And we were able to do it in the last year. We expanded studies in monkeys. We have shown that this protein gets expressed in monkey eyes, just like in mice and rats. And not only that, we have actually done studies in a model where we actually kill these retinal ganglion cells in these monkeys using some laser ablation, and we were able to prevent the death to significant levels using this gene approach. So we're pretty uh, happy the way the results came out. So we're now trying to take this forward into humans, what we call a phase 1 study. Phase 1 study usually is a safety study, but because we have to do these studies in glaucoma patients, we can also see if there is efficacy in that particular study. It'll be a small study, maybe about 15 patients. We are going to initiate it in Australia. We already are in touch with one of the leading glaucoma experts, Dr. Keith Martin at Melbourne Eye Institute. And we're planning to work with him in initiating these studies and conducting these studies starting sometime next year.
So who are some of the other members of the Eyegenex team?
I have a good friend. I belong to a Newfound Venture Group. It's a local San Diego-based angel group, and I used to actually chair their life sciences investments for about close to 4.5 years. And then a good friend of mine and is a fellow by name Steve Gormican. He's a retired emergency physician, and so he's the chief medical officer. He's also an investor. He's also as one of the founders. And then we have Faizan Tai, whom you guys have communicated. He's taking care of all our operations. Essentially, he keeps us straight and keeps our project timelines and all that. And then we have a very knowledgeable, very well connected advisor by name Mark Gleason. He lives in Sydney. He's currently CEO of another ophthalmology company, but he has a consulting. He's advising us. It's very, he's a business guy with a lot of experience. Worked for Allergan, which is one of the big eye care company. Was acquired by AbbVie. So he's back in Australia now, and so he's an advisor there. He's the one who gave us the connection to go to Melbourne Eye Institute. And we also have another Takadoro. He's an MD, PhD, and he's an expert in gene therapy. He lives actually in Tokyo. He's in San Diego, just like your group. We have spread all over. So every week when we meet on Wednesdays, we got worldwide. It's morning for them, and obviously it's evening for us, and afternoon for Faizan in Chicago. So just like you, we're all online and virtual company.
So how much capital have you raised to date, and what is your fundraising strategy?
Yeah, we raised about $740,000,
Okay.
but none of us take any salaries, and everything is used at this point to do some of the R&D, mostly monkey work. They're very expensive, non-human primates. So we are finishing our last study in non-human primates, and based on the data we have, we plan to conduct phase 1 studies in 2 assets, the peptide and also the gene therapy. So we need probably about $20 million to complete that studies, those 2. But we are going to probably raise in a like a tranches, maybe a 5 million to initiate it. And then once we get to what we call an IND approval from FDA for the peptide, then before that, we want to raise maybe another $10 million. So we want to obviously add value incrementally so that the founders and the investors don't get diluted tremendously upfront. So as we add value, we want to raise at a higher valuation. That's our objective. But you probably heard of Valley of Death. I mean, it's easier. People say, we were at a meeting recently, we presented, everybody was enthusiastic. When they hear we want to raise 5, they say, oh, it's easy to, not easy, but it's more easier to raise 20 million than 5 million, because there are very few VCs want to invest that kind of money. So that's go ahead.
Interesting. So the next question, I'm a little nervous about asking because I've done a lot of research and listed your bio and your history, and it could take about 2 hours to answer this question. So we want sort of a dummy's guide or a monarch notes to your career, talking about, really start with when you got your advanced degree in microbiology, and talk a little bit about the entrepreneurial history. You had started a company called Molecular Therapeutics. So just if you could just give us a quick overview of your incredibly lengthy and interesting career, that'd be great.
Yeah, I haven't planned like that. I mean, it just happened, and I guess um, I got this from my father, who was a banker, but also a farmer. He was very in that generation, for him to do several things on his own. Probably, I'm sure, it must have influenced me. But I'm really passionate about science and technology, how it could be used for the benefit in developing drugs, and so that actually um, helped me to go into pharmaceutical company, and then once I had a lot of experience, about 13 years in big pharma, I gotten into startup biotechs in the heyday in 90s. So that was amazing time for the startups. I was involved in 3 startups in California. Once the last one has occurred, I went and started my own with a couple of professors in Michigan, University of Michigan at Ann Arbor. I was involved in 5 startups in Michigan. Yeah.
Wow.
And then when that was done, acquired in 2015, I moved back to San Diego. I was involved in this angel group, now called New Fund Venture Group. It's probably the biggest venture group, one of the biggest, let's say, group in the country. Um, and and then when I stepped down, I went back to my model where I license technologies from universities and put together a team, raise money, and bring it to the next level. So essentially, that's what I have done. I mean, I haven't planned anything, but you know, it happened that way. But I'm still passionate about startups. I'm involved in another one with another professor. So we raised a little bit of money. We're working through that. But yeah, like you said, it'll take some time to talk about. Yeah.
So in one of your other interviews, you mentioned that glaucoma has a personal motivation. You talked about India and some other countries. Yeah, do you want to share?
Yeah.
What's going to drive your vision? Yeah, obviously your that heritage and history. I'd like to know more about. If you could share that with us.
Yeah, actually, it all started. My brother-in-law, my wife's brother, suddenly lost vision in one of his eyes, and then he lives in India, in India, people don't go on a regular checkups. Unfortunately, maybe things have changed now. And turns out he had glaucoma, and he was not, getting any eye drops or anything. And at least the second eye had some vision, and he didn't lose all of it. So he started taking, the eye drops, and then based on that, we and my wife and I, there is some genetic basis for it. So we said, let's start going and seeing a ophthalmologist, and the ophthalmologist, to be on the safe side, put us on, both of us, of course, for sure, my wife and both of us on eye drops. And then I came to know during my alumni meetings, some of my high school classmates lost both eyes. And then some of my my college classmates are, having problems with glaucoma. So it's a very common. So all that kind of gave me an impetus, to look for something that works for the treatment, not the prevention. For those people that 10-15% I'm talking about that progress, that is a big population. So in US itself is like a 300,000, patients. So that's how then I started looking for any treatment modalities that are available, and came across Professor Nagaraj's work. One of the advantages I have is, as a scientist, I can understand science, biochemistry, and all that, and I can go through journals, understand and read and all that. So I was able to find very interesting work of Nagaraj, and then that's how I approached him, and we started the company, and I'm hoping we'll take them into clinic and see if these would work. If it works, that will be wonderful, because we can really make a difference in these patients' lives.
So, other than the clinical trials, so what are the next steps for Eyegenex?
Yeah, like I said, we need to take these three assets. The first one would be gene therapy to take into phase 1 next year, and then the peptide therapy for an acute indication. There are some other indications called acute glaucoma and ion. I think the peptide probably is the right, because you only need once or twice injection. Whereas gene therapy, once you do it, it lasts forever, at least 10 years based on the previous studies. So our plan is to take them into the clinic and see whether it makes a difference, significantly improves the vision of glaucoma patients. And then, if that happens, obviously, we're going to bring it back to US from Australia and do some more studies, what we call phase 2/3. And then based on the data, eventually we'll go to FDA and get an approval. But it's takes a long process, it's not, and then obviously it's science, there could be hiccups, we don't know, but we feel based on the data we've seen in monkeys and mice, there could be, an opportunity for it to show some difference in humans.
So is there any part of your personal journey or your company's journey that you haven't shared with us that you'd like to share before we sign off?
I mean, yeah, I feel, not only me, Ram and myself and the team, we all believe in helping patients, preventing the vision loss. The restoring vision loss with stem cell therapy is the biggest ambition, of course. It's not that easy, but we have a way, at least in, early studies indicate. So our hope is that we'll make a big difference and we'll come up with something for preventing vision loss in glaucoma patients. That's our passion. That's our objective. Okay.
Prasad, I want to thank you for sharing your vision and your incredible journey from India to San Diego, and we wish you the best of luck on your funding round and your clinical trials, and please keep us apprised of your latest developments as the company moves forward.
Thank you very much. Thank you for everybody here, and thank you for you, Edwin. Appreciate it for this opportunity.